podcast don't get this kind of massive support because all of una way they join us every Saturday. So I will let Oga Sam, Dr. Bako, and Oga Boniface introduce themselves to Oga Sam.
Better people, another Saturday don't rule, can't reach you, and I want to welcome on especially to another episode on top this ability inside disability podcast. My name is Oga Sam. I'll be autism specialist and special educator, and I welcome.
So my people now, good afternoon. Like say now, I can't do missing in action small for just 3 weeks or so because of some other things. But then we don't come back because this on our own property, this on our personal passion. Now something we feel say we guys must push. Also say we educate our people, at least people get to understand. Say some people will get 1 or 2 ability or disability. No mean say they're not supposed to be part of us. So we go always there around to push. My name is Dr. Bako Stefanus Bintu. I be neurologist and also secretary NMA Plateau State.
Okay. My people, we don't come again on another Saturday. Another special time. We see we go to share, rub minds together, share 1 or 2. I still remain Oga Boniface.
Yeah, I still remain.
Yes, I be speech and language therapist and special educator. And today, good day lively. Today, house full.
House full. Now, welcome, my brothers. My people, una do well, so now join us again this Saturday. We don't share the topic, so we don't know the topic already for today. And the topic now, how learning and intellectual disabilities, how they fit cause depression and anxiety. It's the topic a long way. And the reason why we put all of them together, we see this month of October, so now month way full for awareness days. You know, say we they get World International Day for the Girls, International Police Day, Teachers Day. Like that too. International organizations don't choose days, and many of them can enter this October. So October na day for dyslexia, October na day for dyscalculia, October na day for ADHD, October na day for cerebral palsy, October na day for dysgraphia, and October can still be day for mental health. And the mental health where our community they suffer well, not be only people will get these conditions, even their family members, because of stress, because of stigma, because of nobody they pay attention, and because of they too not know where they go, how they go, or what they even they do. This their family members. So mental health comes to join this month again. Now we say, okay, we don't they talk about all of these conditions one, but every day now we they get new people where they join us. We thank God for that, and every day an opportunity to still remind each other of what we don't talk before, because plenty is there our head. As we they remind each other, people go they remember, say, okay, you get this speaking when I see yesterday, oh, this is the way they talk, so like say now what the thing way they disturb this pitching, okay, make I call this people number, make I send message without the goofy advice on how this speaking could fit to get help. So today we go talk about the learning disabilities now, where be dyscalculia, dyslexia, dysgraphia. We go talk about ADHD. ADHD. Now in between both of them, ADHD, because ADHD now all rounder. If you find out with learning disability, if you find out with intellectual disability, then we go talk about cerebral palsy. Then we can talk about anxiety and depression and all of these things, how they take connect and why it is important for us to pay attention, to support, so that the thing will be only one before. No, we can't be 3. So, Augusta.
Yes, sir.
Oh, yeah, now. Dyslexia, dyscalculia, dysgraphia.
For people who just join us, and for people when they back, we no take notes last time. This condition.
More than a straight front seat.
These conditions where this is Modupe talk now. Now, some very key conditions where they categorize under learning disabilities. Now, person when you get learning disability, no means say in cognitive level in IQ they low.
No.
it just means they struggle for specific areas of learning.
Yes.
And now dyslexia, now the disability or the difficulty wey join learning disability wey dey affect person ability to read, to take read, understand written, anything wey dey write, whether you type am or whether you write am, make dem fit make sense of the sounds, put them together, blend and read am, then come understand wetin dem read in context, make dem fit give you better response. Yes, so dyslexia dey affect reading and reading comprehension. Then when we move go dyscalculia, which we talk now, I saw some don hear calculia inside there, calculation. So that one, it gets to do with numbers. So children when you get dyscalculia now, they get difficulties with how to understand and how to take manipulate numbers. You know, once pikin start school, in short from house sef before he go school, they already teach am 1, 2, 3, 4, he can't reach 10, can't reach 50, can't reach 100. By the time you don't know, say he don't be strong for the counting, if you identify the number, you move enter arithmetic. So you go fit do small addition, do subtraction, do multiplication, do division. And you know say this na the building blocks of anything mass we put on top. Now children when you get dyscalculia, they get difficulties with how to understand and how to manipulate numbers. Then dysgraphia, the other one we dey on top now. Now say graphia, graphics to take right. Children will get dysgraphia. Nobody say they know one right too, but they get difficulty. I see that part of the brain just dey wired like that. To that part of the brain, no coordinate well where they will help them translate what's inside their head to waiting they feel put on top paper. And you go learn. See, the funny thing with these conditions, we see, if you ask this speaking, make it tell you the response.
Yes.
You just ask her how far. He go tell you. He go tell we go show say understanding
they were to write down.
Pikin will get dysgraphia now to write down. Pikin will get dyslexia now. He go feel know everything. Anything where you talk, he go enter your head. He go sit down. But make he carry the book, read them. Make you feel understand. If you come with difficulty, pikin will get which other one we will call inside there? So
the dyscalculia.
That one will come be maths now. But every other area, you go see say the pikin will do well. Pikin will get dyscalculia. If he even the right number.
Yes.
Pikin will get dysgraphia. If he tell you everything. So now why did they call her? In short, to narrow down more, some people they call her specific learning disability
because it is specific
to one area.
To one area. So, Oga Sam, as you don't give us this, you don't introduce us, you don't help us understand what this tip is. Okay, how parents go fit here and how school go fit here?
Okay, so pikin when you get learning disability, in short, before you even know whether your pikin get learning disability or you don't get, if you notice say your pikin they struggle for one area, no wait for diagnosis, begin find help.
Yes.
Exactly.
Begin ask questions.
Especially as it concerns this learning so.
Yes. Begin ask questions. And you know this age where we dey now, plenty benefits there with the advancement inside
technology.
Yes. Because right now, if you get small problem, if you just carry your phone, type the thing, type it go explain your problem where we're in short. You go know whether now waiting it be this or waiting it not be.
Yes.
And then if you follow get 1 or 2 tips there where if you take support.
Yes.
And now once you don't discover say my pikin dey struggle with reading, we don't try all in siblings by now they may not learn how to read and they in the same school.
Yes.
They different. At that point you go need let the school know.
Yes.
Find out from waiting they go on within the school environment. So in that case they feel begin consider alternative teaching approach.
Yes.
Multisensory teaching.
Multisensory.
And if the pikin they learn well with visuals, you go introduce everything possible to make sure say that pikin
with that visual. So what will be example of visual now?
Example of visual now, if you be say for children where they struggle to read words, you feel combine the word with picture. So maybe when they do CVC words, vowel, consonant, cat, you know those early things where children they learn. If you put picture of cat, then come put the word under.
Yeah.
So some of these children they do picture reading.
picture reading.
And over time, as you dey expose them, their own word recognition will improve.
Go improve.
Exactly.
Because no be everybody they read phonetically.
At all.
No be everybody they blend, make they take read. You get some children wey be say because of exposure.
They don't dey read am,
They
they
don't
don't.
figure out say if you look like na this word. na this word.
Some of us are so carry learn how to read. No blending, no phonics. We don't dey see them repeatedly. We don't get.
Inside this feed, so.
Okay.
Graphophonics.
Okay,
Wey be say-
graphophonics,
yes.
yes.
Where we say every word get their structure. They get how they shape.
Shapes.
They look. So once the child get used to that particular shape where the word get, once he see am, he go just call am. He no go need to follow the phonics.
So now they hear now.
Some of us are so learn.
Graphophonics now be the further explanation of picture now.
Yes.
You don't dey do picture reading. You don't
Yes,
understand.
the people don't understand the structure
Yes.
of that
Shape of the
object.
word and
Shape
everything.
of the word, even the shape of the word self.
Yes. Yes.
So
Now the
picking
shape
go-
be
yes.
graphophonics be that.
Yeah, both of the picture and of the word.
Yes.
And my people, strategies plenty. Wey if you use support children with learning disabilities, make they fit take learn. But
Okay.
now you now go fit take come upon yourself, and as parents, now you go be number one advocate.
Yes.
We go say, "Hi, my pikin get this, my pikin get this. Make we begin find help now." You tell the school teachers, even ask for help.
Ask for help.
Exactly.
That be number one.
Yes.
Accept them. Say your
Accept
pikin
am.
get problem.
Yeah, ask for help. Not the they hide them, they package them, they pack the.
The thing go the worst they go.
The worst they go. You not deal with that help.
Okay. Oga Boniface,
Yes, sir.
ADHD, we did this month. What do they call them now? Na condition we dey very, very common, both for children with the special
learning
school and even regular school.
Yes.
Especially because of different situation. If it just be say the pikin dey experience trauma,
Exactly.
and in way of managing that trauma, wey no fit talk about na in behaviour. My people, trauma be say wetin happen to pikin wey put fear, no be say small fear o, big fear
Fear.
for im mind,
Stress.
and that pikin na e never get opportunity take talk wetin e see or take get help, take bring out that thing, take talk about am so that they go fit help am reduce that fear or even make e fit overcome the fear. So that fear now na be trauma. And you know, wey we not dey in happy state, we dey get some kind behaviour.
Exactly.
For us wey be adults, sometimes we go dey find everything, we dey chop, the belle no dey full. We go dey do
maybe coping
some.
styles,
Sometimes people go dey ask you say, why you dey behave like this? You no dey behave like this before.
Exactly.
So until they know the root of wetin that behaviour mean, they no go fit help you overcome am. So na make am e be say you go see children for regular school wey dey exhibit some traits of ADHD, plus this issue of learning disability, when they dey environment wey they no get support, e go constantly be coping mechanism for them. They go dey look for at ten tion so tey ADHD symptoms go come appear. But I want our people make dem understand ADHD as ADHD. So wetin be ADHD?
Okay. ADHD based on experience. Make I just start to dey explain wetin dey, because na acronym. ADHD, Attention Deficit Hyperactive Disorder. Na wetin ADHD mean.
Yes.
So the first part, make I just talk about attention. You know, say everything, even language, even for us to learn language, attention na the first skill wey child dey develop first before he go start to dey move through the pyramid of language. Before he go start to dey talk, dey share wetin dey in mind. Na attention. If that child get attention problem, he go definitely get communication issues. If the child get attention problem, he go definitely get learning challenges throughout his life. If the child get attention problem, e go affect everything wey dey around am. Even all the developmental milestones, e go dey difficult make e meet am. Because many of these skills and these things wey we dey do na learned behaviour. We dey learn am from people wey we dey see. Even to work sef, children dey learn am. Children dey go see people dey work, then they wan imitate.
Yeah, exactly.
So all those things, if attention get problem, e be say e go affect all those levels. So attention deficit, e mean say e no reach as per the expected, wetin dey expect. E mean say if to say we expect say this child at age 4 go get so kind of attention, if we talk about attention deficit, it means say e no reach the level where we
expect at that age.
And then hyperactive disorder, it means say the behavior no be wetin we dey expect as per that age. We know say children they play. Yes, na their normal way, normal response, normal interaction with every stimuli where they come from, everything where their environment. They can no use stimuli.
They like
where they come from their environment. So now their normal response. But he gets some behavior where you go see say the children they exhibit, they normal again. As in normal peers, he get way they behave. This child will they behave in a certain way where we say they destructive and he no go help and make him sit down learn. So now him be attention deficit hyperactive disorder. We can just break him to that level. But if these things we no address them early enough, I know one project into our topic, but these things they very important. Make we notice them early and make we start to there, because if you no address them early, you go they conclude say this child na destructive child, this child na stubborn child, and you no go know say the child get challenges. He needs person make him look into the matter and start to know, okay, this child, if I say he get ADHD, because ADHD no be only for children we get learning disorder. No be only for children we get intellectual disability. Even our regular children, get some we get ADHD, traces of ADHD. Even maybe in a mild, moderate, but some they see there, you go see them, they go very destructive. So na serious matter we be say everybody need to put eye upon. Make we know wetin dey happen for classroom, for house, for everything.
Thank you so much, Oga Boniface. So we don't talk about ADHD now. We don't talk about dyslexia, dyscalculia, dysgraphia. We be learning this. Dr. Bako, this month is a month of cerebral palsy. So, what is cerebral palsy?
Yeah, my people, now well done once again. Cerebral palsy now one of those genetic problem will happen for person when even the belly sin they form. So that's what they call it trisomy 21. It will always happen say for certain, because waiting form all of us now genetic makeup, our DNAs that then form must be waiting will be on a very good day to become normal. But then individuals will get cerebral palsy. Sometimes you see say for some reason the genetic makeup, instead of the normal say 23 way one sex chromosome will be where we come back become 46, but they are on one particular part for that area of that the 21st one gets some kind of funny increase than the number we supposed to be for that very person. So it become a problem. And this is a certain protein go they transformed way no they in tandem with waiting the body supposed contain. Then these individuals can get some abnormal neuronal problem. So certain nerve connections no go really dey the way other people own go dey for inside their brain, and that one will come with some plenty problem, from their ability to at least get cognizance, relate with people, their ability to learn, get intellectual backwardness and everything. So those ones will affect their normal growth, even their ability to walk, their attaining their milestone for their age at that particular time. So that one are much more of a genetic problem where they happen, a mutation when picking day belly as mama carrying for belly. And most of those things happen sometimes maybe because of one high maternal age, maybe mama or papa age, they upwards before when the pregnancy fee happen, or maybe for women where they get belly, maybe they can't get one sickness or the other, they can't go choose to they take certain drugs, and some of those drugs they also affect the child, especially for individuals with the first 3 months of pregnancy, because that time most of the organ for the pikin body they develop. So any mistake way in the event of that development, because the genetic connection they happen, those individuals take some drugs we feel for medical time we call it say they teratogenic, or maybe they feel affect the genetic growth of that person. You see, say don't distort something, and subsequently that begin no go fit just get the way get that exact growth as they expect for other normal children as they grow inside belly. So you see, say when I'm born these children now, the next way you go see now with this all of those complications will just come into play.
Okay. But I get this question. Cerebral palsy no go fit arise because of no go fit happen because of brain injury.
Yeah, primarily because whenever cerebral palsy, whenever it happen, there's a tendency say, especially with this DNA problem, this is a injury really happen for the brain because one the genetic makeup way supposed happen at that particular time don't distort something and there's accumulation of abnormal protein and subsequent genetic brain injury. Funny ones they still happen like the one who the only way they very common with pregnancy and during delivery, anoxia and everything. Even ordinarily self, people where them pick them born can't get jaundice, they don't manage and the way they're supposed to manage them. You go inside part of the brain where they call basal ganglia, go stain and the person will still come out. You say it will come become floppy. Even the ability to use your muscle to even work on normal, you see begin they drool and everything. So you get all of them now directly inside the brain, they go affect. Even say during that prolonged labor, so some people they get, you say those ones just come out with anoxic brain injury and subsequently the affectation come during their upbringing again. Developmental milestone to meet up become problem. Even for self-delivery, all those are they use force, only picking heads to pull them down.
Okay.
Because even the sutures for the brain, then even the bone self they even soft that time. So they feel cause little compression.
Okay, so which means say you know go fit separate genetic reason from other cause of injury.
No. For cerebral palsy, primarily the palsy primarily now genetic problem mutation. But then other physical injury or fit cause them, especially during when mama dey labor to give birth to pikin.
So na combination of
A combination of two things.
Okay now. Everyday person dey learn because my own understanding of all along now say injury happen.
Primarily injury. dey
Primary
full happen.
injury, but I'm not thinking about the genetic component to it because for example now like Down syndrome now genetic component.
Gone down a pure genetics.
100%. But now cerebral palsy are both combination
Of both genetic and the same, but much more of the physical part
much yes,
than what you get from Down syndrome.
Okay,
Now more of the physical.
The injury go happen for where go control the
Physical part inside.
of the pikin.
Yes. And that's why we're so worried that if you're pregnant and you even get one sickness, not just choose to take any drug. First of all, just try go hospital. Because I guess some drugs will affect your picking weight inside. Get some will you cross the placenta barrier, we go enter the blood system because your communication your picking are through the placenta. So anything you do your body, depending on the concentration, if you cross through the placenta and you go enter the picking blood circulation.
Okay, so which means now say the level of severity now, now the level of how the external factor they affect and reach.
Most importantly, the external factor na them they cause the genetic change if you happen inside.
Okay, now that external
Now from
factor
outside,
they
induce most of the thing where they happen inside. Primarily, because primarily. I mean, ordinarily we go to say person if you get cancer ordinarily by exposure to certain particular rays of the sun. Your body they normal. But then because of exposure to the particular rays of the sun, because we get actively dividing cell. During those actively division of our body cells, because we they grow, that's how they feel cut our nails and everything. Because things they grow. So during those processes, okay, let's say ordinarily UV radiation from sun. If it distorts during those processes, cause mutation and you feel get cancer.
Okay.
Oh,
Oh my goodness. Okay. I like this education today. Okay. Dr. Bako. Thank you, sir.
Yes,
so now the external, so now they here now. Our mama and those of us we go be mama tomorrow. Muna dey careful when I get beleo. When I not eat anything, chop this and the chopper for our family.
Go to take agbo, go to take herbal medication.
Not mind all of those doctors. What did they know? Not be only you again in Nigeria, your pikin, go hospital. Go hospital. And when you want born the pikin, if the pikin don't dey too tey, go theater. Abi?
Yes, no delay.
No delay.
Very
Then
important.
do CS, carry the pikin come out so that you and your pikin una go safe. Because cerebral palsy na medical condition.
Medical.
Medical condition because Don't be say others not be medical condition. But this one, na injury.
And really, now what we fit prevent
Now what exactly?
easily. We fit prevent them, but then
Let me dey
if
talk
we
am
not
now.
prevent them, then it
Make
will
we
become
talk am
problem
now,
where
so
we
now wetin
go
person fit
handle
prevent?
till for life.
Yeah. So, Dr. Bako, you again.
Yes, ma.
Now, this cerebral palsy now. Okay, before Dr. Bako, I'll ask Oga Ini. Now, this Oga Ini will start. Oga Boniface will finish. We talk about learning disability just now. We talk about intellectual disability. What will be the difference?
Okay.
Because now revision now with this.
Yes. I happy say I put this one when I did talk. Say, most recently, they don't call them specific learning disabilities. We mean say the picking will get deficits inside either reading or reading comprehension with dyslexia, or it will get issues with understanding and manipulating numbers with dyscalculia.
Yeah.
Or will get issues with
Writing.
Look, if we write it in their mind.
It's day mind, it's day head, yes.
Maybe
Dysgraphia.
Now, I follow mention say pikin we get dyslexia. Fit sabi maths through it. And he fit too sabi maths. But when you come to reading
English, I dare fight there.
or make he answer social study essay question, you go into
Or you can carry history given.
problem will come.
And a
before
war.
them. Or this pikin now, he know maths, he know English, he no problem as he write.
To just write, no problem.
And you know, say for this our client, we like to copy notes.
This
And
is all notes.
and so they go they tie that picking keep no go ask when everybody they go they say you
Because
must
you
finish,
get
you
more
must
copy
finish,
your
you
notes.
must finish the notes. And the picking now over time, if the thing too harder, you go begin find other behavior.
Yes.
We go distract you from the real problem. Either you go tear the book or break the pencil or do one thing, make you punish her. When you punish her, you will say, you must not go
How's
house.
it go out?
You don't tire.
Don't tire.
So you see, it is very specific. But intellectual disabilities,
Yes.
on the other hand, it is broad. Now, intellectual, mind, brain, disability, we say it affects how the person brain they work, it affects the person brain ability, and how do they measure levels of intellectual disability? They use intelligence tests. It's they call IQ tests to take know the person cognitive levels, how the brain they work. Now, from I think typically now from 100 and above. No, from 70 and above, then they consider normal or
Cognitive functioning.
But anything from 70, they go down,
Down.
all the way to 0.
69 down.
From 69.
69 down.
Hi, thank you, Boniface. From 69, go down. This 0, they consider intellectual disability. And as they go down, so the impact, the severe they go. Yes, because in that level, anything from 20,
That be profound now.
they go down. Those ones they go need full custodian support
For the rest of their
for
lives.
the rest of their life, because even skill where you fit teach severe cases where okay button your clothes,
They fit not fit
use
button.
spoon, carry the spoon go your mouth,
Wear
put
your
the spoon,
socks.
wear,
It's a
you
problem.
fit no fit teach
This
the
was.
ones wey dey profound, right? So you see the difference. Learning it dey affect specific domains, specific areas of learning, but intellectual e dey
Across the board. Oga Boniface.
Just to add on top wetin oga Ini don talk, e also get for learning disability, e also get some children wey dey get some, apart from the specific wey you don talk, e get some children wey dey get dysgraphic dyslexia.
Yes, they combine.
They combine.
They follow body.
Yeah,
Sometimes
maybe
not be only one.
Yes,
Exactly.
yes.
It is hard for you to find only one.
Exactly.
Most times they get friend.
And sometimes now how bad we dey handle
One,
dey
you go
lead
come
to the
affect
other.
the other. Yes.
If the child know dey write well, and you don dey isolate the child, before you know, he no go learn to read when he mates dey read.
Yeah.
Because you don take that time isolate am.
Yeah.
So e go appear say him dey dyslexic too sometimes. You understand? And some of these problems, like I mentioned, they come together, but no be all the time. If we fit notice am early, address this one wey oga Ini talk specific learning disabilities, then e no go give room for some other. Whereas some they come like that, they come with these two together.
Yes.
So for intellectual disabilities, like we talk, then IQ they tell us where the child they, whether in the profound, whether in the severe, whether in the mild or moderate.
Severe.
Yes. But for those levels, you will see say like we talk, the brain activity, the functionality of the brain, and him the thing they target, the thing they affect, how the brain they take form, how the brain they take respond to issues, like him be that particular challenge. You will see say the challenge, the child they express those challenge for those areas. Yes.
Okay. Oga, I want to ask one question. Oga Yeni and Oga Boniface again briefly before Oga Dr. Bako will answer your own. You know, when they talk about all of these conditions, we always mention children. Because all of us, they start from children before we become adults. But all of these conditions, now waiting they live with person for the rest of their life.
Yeah.
Especially when they not quick get early intervention. Even when they get early intervention, not be say if you know they there, but you go don't reduce well. Because me, I dey run away from the idea of to tell anybody say he go heal pata. Because I understand what you hope fit do for us. When you don't put your mind for something, say if you take this Panadol, the headache will go. If you not can't go, the thing when you think will come make that headache double.
It's like that. Also.
So I dey always run from that final verdict. Say if you do all of this,
You go well, you know go happen again, you don't solve.
Because every pikin not be the same, every human being not be the same. The thing where they trigger them not be the same. But the thing where I want ask, where I want make una talk, join this one with the talk since we say I want make una let our audience know how this dyslexia, dyscalculia, dysgraphia, ADHD fit affect adults. Because when they talk about children, you go be like say
Now,
maybe when they don't reach 16 years,
You go stop.
Thank you, say you don't go shake that table. That 2 legs in it. Small time that you go fall. Because sadly, we don't hear things like, in short, person go, I don't know whether na better intention or but you go just get mind, go tell picking parents. They don't know what it say. Come up for the thing.
No, remind.
That mind though. Specifically, make time they go.
So that you go come well.
And by the time everything comes spoil, you self you go don't find your you go don't do your day. Come on and just say na me talk am. Now the issue is say most of these conditions, learning intellectual disabilities, are lifelong conditions. Autism, specifically all these their dyslexia, dyscalculia, ADHD, all of them are lifelong conditions. But like waiting we supposed talk now, you see early intervention, proper appropriate support. It improve quality of life for these individuals. Yes. Sure, for some people, they go fit down, adjust, so if they know open mouth tell you.
You know, they go live their life very normal.
Exactly. You know, now where awareness don't really climb, you get some things where they happen where they give me joy. Say some adults don't they come out, they talk about their struggles when they be children, and say, guy, so now waiting I've been the good thing with this. Some people will tell you say I choking tire. Some people will tell you say my self-esteem, I know even stand among my mates that time because nobody understand this condition. So either they go say you lazy, you stupid, you be dunce.
Dull boy.
I don't know whether that dunce na English. I mean this one is a dunce. So people don't go to, I don't meet this year. I don't meet at least 2 adults, women. One tell me say kind. Say she dey struggle with spelling. Say na autocorrect na she dey use. Say
good.
Technology don't help her well. So when she just type her autocorrect go show. She go say, oh okay. But if you give her message right now, so she don't miss the whole
everything.
Thing.
Oh, na classic dyslexia.
But you know mean say in short she dey work. She get children. She dey alright. Wey mean say dyslexia no be
and the thing where that her brain fit do. Regular people like us
now rechanneling now.
Channeling of the brain.
Now I meet another woman this week where we just get one discussion. Now she said no last week. we dey get one discussion. I say, say make her pardon am, say she get dyslexia, so for her she needs a go over material over and over, make she fit comprehend am well. So make her just
accommodation.
And the thing sweet me for body. Say this one don't reach level.
He say he accept am, no shame.
You know what's up.
He accept am, then he dey even advocate for himself.
That's good.
Say if he ain't go anywhere where you want to do am anyhow, you will tell you say, hey, come.
Calm down.
I need time.
Yes, exactly.
Calm down.
And now wetin we want to make our community.
Exactly. Maybe when you say dyslexia, they say, okay, dyslexia, but these are people that sabi draw well. What you sabi do?
Yeah.
So the conversation don't come up first. Hey, dyslexia. Hey, how you go do your? Hey.
Don't go tell you say you don't give you your dullness fine name so that when I feel they give you your dullness fine name.
Presentations will improve over time with the right forms of intervention.
Yeah.
You cannot finish talking.
Yes. So. Okay, Boniface. 1 minute.
Hey, throw something put.
So I don't want when I use Dr. Bako time finish. Dr. Bako still get 2 questions. Get the question one never ask her.
No, say
1 minute.
he don't finish, he don't cement the whole place. Let me just
Don't put that.
No, say for our adults we get these challenges. As you dey grow, you go the day exposed to so many conditions. When you say you don't form coping technique, coping strategy.
Where you fit the manager.
Yes, the manager. You understand? So wetin I go advise strongly for our adults we get these challenges. You don't come know about this thing. In fact, many people like wetin you don't talk. You say many people been dey this condition, they no know say they get am. They just they suffer am silently. And as they grow, they can't tell themselves, say, "Kai, book no go work for me." You get many of them I know. They tell me, say, "See, if na book, I no sabi. But if na this handwork, na him I sabi."
Excellent.
So and as you dey grow, people go dey emphasize say on top of wetin you know sabi do. You emphasize on top of wetin
you sabi do.
You understand?
Yes,
Now wetin we dey talk? Wetin you sabi do and show them say you sabi do am well. Now wetin, in fact, if you come out for our society, they no go ask you 1 + 1. They no dey ask you read, you sabi read. No, wetin you sabi do wey be say you go fit exchange for value. So for our adults we get these challenges wey be say you no get chance for early intervention. Focus on wetin your hands sabi do.
Good advice.
Improve yourself. That now from that thing you go get correct self-esteem. You go dey do something.
And you go even come give people wey go to school work.
Exactly. And with wetin you don come know,
Them plenty.
wetin you don come know, you go become better advocate because you go dey share your own experience.
Exactly. Okay, my people. Dr. Bako, you go quickly answer these 2 questions before I ask you.
Yes,
ma'am. I
ma'am.
want to ask you. The first question be say, okay, it good make pregnant woman they take traditional or native medicine when they pregnant.
I know where that question dey go.
Now the question be that have you another one they come?
And the second one be say, person with cerebral palsy, whether you fit detect cerebral palsy through ultrasound. Since Down syndrome these days, then they identify am through parental screening.
Yeah.
Yes. Yeah.
So that very first question are just very, very easy answer. Because you no suppose be like that. We no suppose take agbo or take any herbal medication during pregnancy. That we could always advocate for. Say, I beg, if you just know, say, like if you go meet obstetric doctor, they go tell you, say, when you don't plan to dey pregnant, start take folic acid or folic acid. When you don't think say you want dey pregnant, talk less of when you can't dey pregnant. You get basic things we supposed to take, and these 2 folic acid and fesolate, then they very, very good because folic acid now where they carry help, you see, it dey help so that especially the formation of the neurons, especially as they go down towards the spinal cord. So that they help with spinal cord development. So all those children sometimes we say them born them with one growth for back with their leg they paralyzed. Now because of the spinal cord no form well, most of them are because of the absence of folic acid. So it is very, very important. So they don't say they give them because they give them. The first one is because say woman when they pregnant, everly she needs blood because now her blood now for 2 in as much as the pikin can create your own. But the more of the feeding way in they get, maybe saying they create your own food. So now wetin you eat through the placenta, you go cross enter the pikin circulation system, then the pikin ma go enjoy. You understand? So you need make your blood dey optimum for this very exchange fit happen. Okay, because if you get anemia, you say that's a check go dey reduce. Now you say pikin go come dey growth restriction even when dey inside belle. Because one, there is no enough circulation wey go lead to increase in presentation from the mother side to the mama to the pikin umbilicus through the placenta, because your own blood level dey low. So they want me your blood level dey okay, while the folic acid is to prevent all of those neuronal development, especially around the spinal cord. So any of those herbal medication they take, well, most of them don't know the active ingredient. Yeah. We don't know where it go affect the pikin, as the pikin still they develop inside mama belly. So when they try to say we push those things down, because it go cause problems. Some of those abnormal genetic change wey dey happen when pikin dey try form, some of them fit be from most of those things wey they take. Ordinarily, even drugs wey they give you for hospital sef, when you go to see your doctor, you bring one particular presentation, the next thing you have to say, before they give you the drug, are you pregnant? And I make, even if you go hospital, we get one problem or the other, even before the doctor go ask you, try to give them that information. Because sometimes I feel inside discussion forget, and I will go give you drug, go cause problem.
Exactly.
Because like us neurology now, we know there are plenty of our drugs where we say if woman wey dey pregnant and give her, it go cause problem for the pikin. She feel okay, but it will cause problem for the pikin. So most definitely this one are important. So any medication we don't know the combination in which AKA Abu Habal, now them did that fitting. We dey try please and please. Medically, no, it's a no-go area for us. So I don't answer that one. That's just the summary. All the other talk that to just make we get insight, say, see why would they insist on certain part of the medication and why we must always talk to our doctor. So mostly, yes, for Down syndrome, that's the try. So those ones they clear say modern modalities of care, some scanning modalities that even though if you just take the fluid from mama from the womb, even go analyze them, you get certain proteins where this in circulation, where they if you pick that one, Down syndrome, where if you get them easily. But then for picking, most time because now the problem where they happen during pregnancy, majority now they cause most of the pulses where they happen. Very few will say maybe that, but majority now from that process of delivery. Now they happen. So you see, say at that time it don't somehow look like very too late. But then these are things that we feel prevent. Now me go to emphasize on the fact say if the labor don't come, you don't say you don't pour liquor, I bet me don't reach 24 hours. Because the pikin now don't start get problem inside belly already. If you can't reach say man, the labor don't dey prolonged, I beg intervention and be the next thing. Now I always advise say, as you dey prepare to born normally, put CS as the first thing, then why you hope to born normally. So that in case the thing don't dey too long, intervention will just happen without anything. So that made that pikin no come suffer. Because last not even the pikin alone go suffer. About you self, you feel lose your life. So those ones, primarily there is no direct thing where they fit check when the pikin dey pregnant, but because more of majority of what they call cerebral palsy now during the event of labor and delivery. Now in those things they happen. So for now, no anything presently like what we they see for Down syndrome.
Okay. But labor and delivery plus what you go take.
What you go take go cause plenty problem. Yes. So those ones we need to fit detect them for now, but then just try and see say you prevent yourself from engaging on all of those things when you're pregnant.
I mean nurses too, nurses and doctors.
As in men and they on point, very important. Very important.
May they know they take, may they know they
wait.
They drag leg, may they know they wait.
May they waste time for this kind of thing.
Okay, Dr. Bako, we don't talk about CP now, cerebral palsy. We don't talk about dyslexia, dyscalculia, dysgraphia, ADHD. So now, anxiety and depression now.
Very, very important part.
Yeah, now. So these two conditions now, they stand alone by themselves as mental disorder.
Yeah.
Where if you even go enter disability,
yes.
As disorder enter disability.
Yeah.
Depending on the level. But they can't still be condition when person wey don already get dyslexia, dyscalculia, dysgraphia,
go can get.
ADHD, go post to get. Why if it be like this?
Very, very important. I come out take position because Because as a matter of fact, last night, and even our listeners when I follow this somehow some of this very topic now, this one where they just ask now, they always chip them. Even when Boniface they try to talk, they chip small.
Yes,
they carry good
right.
because somehow the thing my borrows or Ogasan what they carry body come
They work together.
they work together.
Don't they stand for you?
They carry body carry come follow body come, you understand? So now let's look at learning disability and intellectual disability. So that I'm funny enough because most of those things they always happen from young people as they grow.
Yes.
You understand? The thing gets psychological and emotional impact, then get physical environmental impact.
Yeah.
But then somehow the tail end now be the primary question, which is the anxiety, which on its own the anxiety, whenever you know they properly channel, I know they handle, you go still lead to the depression, or you go even go directly to the depression, jump the anxiety.
Jump the anxiety sometimes.
You understand? So psychological, what do they try to talk about? You see, it's a Pekin day school, and it's so unfortunate for our school system today. They always want to at least see people way first 1, 2, 3. I can remember one day primary school. Primary was number 1, 2, 3. They are the best. You see that at school, will give them gifts. But all school after they feel say that they try to motivate, but then don't know say get people we get special problems, supposed to get special attention. We're supposed to get special attention. But for their mind, they just be say, first 2, 3, then they will give them gift and everything. Then the others, when they feel bad, then tomorrow when they read well. They don't know, say, no be so detail really be. Were they happy with the modern thing? And why would they advocate to see, say, make our school system change the idea behind most of those things?
Yes.
That same person, if you know something now like this, don't mean say, now because you know in the door.
Exactly.
We always talk and say, if brain dance ahead now. It means, say, man, you get, there's limit to what you know feed you. But then that to just know waiting me the primary problem where you know if you attend this thing.
Yes.
Men and give you extra time and teach you using all of those modalities so they talk.
Yes.
Because when other people 1, 2, 3 they come read for class and everything, or you call somebody sabi other students sabi say you come and read this thing in class. Those students sabi nobody will call them. It don't they affect them psychologically.
Yes.
Some of those start feel like say the no sabi then they too dull.
Meanwhile, get what they feel do well.
Now their self-esteem go come day down. They're gonna go there too free because of either maybe dyslexia. You see say they no fit even relate because most of them will get some of those conditions. Even non-verbal cue na problem. So if they talk amongst their peers, their own they don't understand certain things where maybe the top person come from. You don't even understand saying they try to tell you say what you talk don't make sense or your gist not really correct to what they talk. He may go continue, but then people go say this one why they look weird like this guy. The guy saying no get sense. And the guy don't say. They just try. They try start isolate the person. Even they go say, "Can see this mood on the car, they wanna leave him." Because what children fit do like that? They will not leave you go. You say tomorrow 1, 2 times come, no 1 time. You go just choose go sit down. Only him. Imagine that thing that happen to somebody repeatedly. Even you come house and then bring assignment, come back house, they want to try to teach you. They repeat. Our own home self, for family, for house self, we need a help matter.
They know.
See your junior sister, they try this thing. Look at you big. Or there, you know, guess and see your junior sister where they 3 years, if you do this, you dey 5 years, you know fit. You keep passing the same message to the same child. You are what they call her learned helplessness. You will call accept, say, okay, you not done did that here. So you not going to fit worry yourself about say you want to do anything. They say even if I read them plenty, say I not going to learn them again. I not go sabi.
Behind that casual acceptance, not depression.
Now the next thing with that now, because you say when nobody relates with you, nobody play with you, nobody even want to engage you, even the teachers don't even give you time. You start become withdraw. Your family, you go out, so only you they play on your own. Any other thing you do on your own. You know they feel happy. Come eat for family table, you don't eat once, so you don't work. Go inside your room. When they discuss, you don't want to tell anybody. Now depression now, those things you want to do, you not do again. Subsequently, the person start get suicidal ideation. Yeah. Now you say when you say if you go to psychiatric clinic, you go believe now. If you see the young people who don't try to kill themselves, all of them are because of this thing. One, the school dynamics no they help, and even the family dynamics. Presently, like this, them being called me to admit one patient. Though we don't on Friday just call psychiatrists when they take over. This boy grew up with learning disability because when I can't get the total history, now I'm going to say no, psychiatrists have to take over the management of this patient. You know if you attain academically for class, so every other person can reject even from the home. When we say when he go finish drag finish secondary school, in say one go university, the parents say this one a waste of money and everything. Before they say Jack, this boy can't deal withdrawn. And everything don't attempt suicide, but now he's 26. He don't attempt suicide while even the teenager, as a teenager. As as in today I even shake your hands sef. So they be like waiting at the talk say pass. Today me and him shake. Instant your admission. The indoor attempt suicide, but now he can't get what they call psychogenic non-epileptiform seizure disorder. As in maybe real seizure, but I mind the play trick of them because in don't they withdrawn. In the that are really the acceptance of your helplessness. So if you don't accept, say you get seizure, but not the seizure. But then you don't even feel control them again. So you don't become psychogenic. So because if the seizure disorder, if they convulse, nobody will talk to you. But then this other person, if you start convulse, I will shout for him, then it will stop. You see, so automatically be real seizure. But then you know if you control them, after a while it will continue. So this now the kind things if it happen.
All of this na medical condition where come
really don't come to because
now.
one just say pikin no gree
Yeah,
fit
because say
read.
pikin
You
no
know if you
fit
read
read
well
well.
for school, then we no manage them well. Then it leads this person dey
Must
26
everybody
years
go to
old.
the school?
Now need dey admission because of waiting in start learn from when in the
small pikin.
primary school. Now it affect them now till date as an adult. He dey on admission now. So this one a local example. Maybe. So when we finish take the history, they'll say no, let's go to psychiatrist. They will help us. So you see how it they go to depression, suicidal ideation, withdrawn, and everything. So I beg my people, we they beg again. We will try our best to see, say at least we they give these people attention. So small like this, now depression they come. Before you say Jack, person don't commit suicide, they will look for answer because the parents don't know, so they don't mess up. They will just to say we just keep messenger comes to alone. Don't forget to maybe get role with them and then follow play with this person. So ordinarily, where would they say and say ordinarily learning and intellectual disability, if it lead to somebody even into a grief if you don't handle them well.
Dr. Bako, you do well for that very, very deep answer. Because at the end of the day, when we marry, everybody dey pray for pikin. When we can't get pikin now, just because the pikin come different from what we dey expect, we go just forget saying a human being. That is not right, you know. Now I will take answer this question. So the question say, what a person fit do to prevent this learning problem for children? Now Dr. Bako just talk. So first of all, Mona correct me if I'm wrong. Nothing one I go fit do to take prevent learning disability if you go come. That is, if you say okay, maybe the pikin trauma, but learning disability with me I know now the way where the brain dey wire. The pikin come with her, and because say the pikin come with her, that one mean say na God bring that pikin to you, so come take test whether true you be your brother's keeper. Because you no go fit dey pray, dey talk say you like God, you like everything wey God create, and your whole pikin wey get any disability, you can't live her, may enter anxiety, may enter depression, can't get epilepsy wey not carry come because he not sabi read and write. This is just unacceptable. Nothing dey right about this kind of thinking. Just as people dey poor, not be say they no dey work, they dey go out, they go work, but at the end of the day, they no dey get the kind money wey dey for the kind work wey they do. Because God not give them. The God they create us, now create Elizabeth and all of his children.
Yeah.
The whole UK now they work for their pockets.
Yep.
If all of us not come up for us, go work. Nobody go work for our pocket. But people sit down now that they work for inside their pocket, not just their own, the generation unborn. Now as go want it thing, now you go to arranger. The most important thing here be say, once we don't notice difference for our family member, make we help her. Because I don't understand why person go cut hand now go dey run rush go hospital now wan go treat am. Person go say he get headache now go chemist now wan go find Panadol. So wetin come with the difference between that one and pikin wey no fit read wey no fit write well? Help na e dey the help wey the person wey get BP get diabetes. One born pikin cut him hand cut him leg break him head, the help wey they need na be the same help na pikin with Down syndrome, dyslexia, cerebral palsy, ADHD, autism, na the same help now all of them need. If we fit see the human being in all of these people, whether they be our children or they go the same mosque or they go the same church or we they shop for the same market or they be our neighbor pikin or they did the same office with us. If we fit see them first as human being before we they see everything wey they know sabi do, problem don solve by more than half.
Yeah.
Because all of us na test for each other. Now that will be the answer I get for wetin person fit do. Not the way you go fit do to take stop wetin God say go happen. People take their time to take research, can't know wetin this condition be. They don't make life easy for us well. At least we know wetin we dey deal with. People don't take their time, work, do research, use their brain wey God bless them to take create materials, resources on how we go take teach these children. The only thing wey we need to do now is, if you be teacher, equip yourself. If you be parent, train yourself. And the first training now, the training of acceptance. Accept your pikin, like am, see other things wey you go fit do. This 26-year-old boy now no really read and write if he do. Many things dey wey if he do, but because a family na let that read and write now they see, they don't see another thing. See where they carry this boy life reach now. This boy, many things dey wey he go fit do if he learn work. So I beg, may we not always dey look for the only things wey I know say we go fit prevent. Dr. Bako don talk am. May we not drink wetin we not suppose drink when we get belle. May we not drink alcohol. May we not smoke cigar. All of us know that one. The dangerous things, we know am. We don't need anybody to tell us. But the other things, now the way the brain take come be that. It be like say your papa and mama tall, but they born you come short. What you want do? What your papa and mama for do? May you for take tall. You know they now. Now as you take come be that. And they go like you with your shortness. Maybe you will come born and come body while you wait up past your parents. It dey happen.
Yes.
All begin with acceptance and support. Because now so we go to be our brother's keeper. Not be just mouth talk. So, Dr. Oga Sam,
So,
get anything when you want to add? No, so that we go.
we
Go,
will greet our
people, yeah.
If I won't add anything now, it go long. I will say opportunity you dig in, we will talk about,
Exactly.
especially the role of parents.
Yes, opportunity go there where we now.
Inside
Now I
all
work
these
with that
things,
for here.
Because as we dey talk,
Mm.
it don't dey bring back some plenty memories.
Memories, yeah.
It don't dey bring back plenty unpleasant
That's memories.
And now some of the things I don't dey even see play out presently with some clients who are dey
When you don't,
where I
when you
don't dey see, or some families wey I don't dey consult with. It no be better place. Children dey really struggle, and most times you go see say no be their making. You go dey see like physical abuse, meet pikin almost every day. Na so mark. You go wetin happen? You say no right, you no gree do homework, you no gree. So mark. Next thing, pikin wey been dey very lively, you see am begin dey shrink. Before you know, you don dey throw away things, you don dey misplacing property, you don dey.
you would dey peace for house.
Enter trouble.
The bed wet.
Na very serious matter wey we will talk today. So our people, abeg, you get pikin, you know pikin for your environment. You be teacher, you see pikin inside school when you dey teach. If you no fit be part of solution, no join the
Join
problem.
add problem, I beg.
If you no fit be part of solution, no join add the problem. Because at the end of the day, when it happen, God forbid say it happen. When it happen, you go find way wash your hand, come out. Na see the parents, na see the family.
And the
go
pikin
tell
himself
you,
or herself for the
yeah.
rest of their life. Now go
So-
carry that mishandlement. I
So-
mean, now my handlement they call am.
So my people, make you no be say we just dey show every Saturday we talk, then once we move everybody don't move
Forget
on.
again, yeah.
This yarn na say make we become better advocates, make we build more inclusive society, make we increase support, and I wetin I fit join inside this topic.
Dr. Bako.
Yeah, at least we don't hear the whole talk. We don't hear the whole matter. We don't at least touch almost everything. Because as a matter of fact, for the fact say most of this problem fit leads to even person that I think now something we supposed carry am serious.
Yes.
More no carry am play at all. Say your pikin no need a fit assimilate something as in other age mates. No mean say in the very stupid. It means say may you give them extra time, may you get to understand where in problem they come from so that you fit take so carry help am. Like the example I give now very big
Very
example
sad
wey
example.
pain me well. So I beg more just try to say we help our children may no reach that kind of level. Thank you.
Yes, and we need to be trauma competent, everybody. Because if
What you be
if
trauma competent?
that is we fit handle issues. No be say you go just see bad behavior, you want correct am immediately.
Immediately.
If you see bad behavior, try to know why this behavior dey happen.
Why?
Wetin be the source? Wetin lead to this particular behavior? Na him be say you dey trauma competent, you dey sensitive, make you no come add
Join
on top of the case wey don dey
Ground already.
so make we dey very sensitive, because if at the end of the day we no dey sensitive, we go dey join dey add problem.
Join
Like
problem.
wetin oga Ini talk, if you no go solve the problem, abeg no add
Add
for the
join.
problem. Just go find person wey go fit help the condition. No be say you go just summarize anything wey you meet, no just conclude. Go find answer, ask questions, relevant questions wey be say you go get answer, then you go fit get proper solutions wey be say you go understand the condition. Because one of the best solution to a problem na to first understand the problem. If you no understand the problem, anything wey you dey do dey lead to frustration, you go develop to anxiety, you go move to depression. Even depression for you, depression for the child, everybody go dey depressed.
No.
Everybody
No joy.
No joy.
But
Kill the joy.
if you come to a point where we say you understand the situation, at least you go dey face the situation with intention. You go dey face am with say, yes, I know say this situation dey ground, and we know wetin we go do to at least solve the problem wey we get. Na the best approach be that.
Okay, Oga Boniface, okay, it don't reach for time for us to go now. Yeah, tell our people.
My people, I thank una, all of una wey don stay from the beginning of the program till this moment. I wan appreciate una well well. Make una do well to inform others. Make they join us next time. We get plenty matter wey we need to talk, but you see say time don cut us off. So till we meet, same time, same venue, same station.
Same station.
I don't know Boniface. Thank you.
Yeah. So my people, now well done. At least I believe so. We don't learn small thing. Till we meet next week Saturday. Thank you.
Better people. Now thank you well. I know if you wait to see on next week, and I beg Mona carry na questions come. Based on everything we don't discuss.
Yes.
Mona do well then. Bye bye.
My people, now do well. Oh. We don't pass 4 o'clock small. And I do well for our patients. We don't talk plenty today, not be small. I beg everything we now see now, Dr. Bako make life example. Imagine, just because Pikin no fit read and write. Waiting. Now the boy 26 in the hospital. Only God know how his condition will be. May God heal him. And may God help the parents accept them, and may God help them understand what they go and fix themselves, because their pikin go live their life, live in life. Make them to live their own. Make we know they use wetin we know fit achieve, so our pikin must achieve am. That will not be good, correct way of doing anything.
At all.
May we discipline our pikin, but may we know say our pikin they come their own life. Support them for wetin they want to, pray for them. But not insist because I know if he become policeman, my pikin must become policeman. Ah, that one not good though. Any condition where our children get, may we support them, help them. I beg. When I tell others, and may una too help others, because the best way to support now to show how to support. Because person wants support, you know. But if you will, they listen to us every day, every Saturday now, una show by example. People go to learn from una. And that one now be the real advocacy we would talk about. And that one be the real brother's keeper. If everybody they shout for one pikin, maybe now we go come out. Someone not shout for this pikin again. You know they do it because you want them. And even if they do it because you want them, not be today, it go stop. So this shouting not go help. It go add join the problem as Oga Boniface talk. So till next week Saturday, now do well.